screen and put up the PowerPoint, and then school nurse Dawn Leibold will start from there. Okay, share screen. Oops, sorry about that. It's a little slow. I wonder if it's because of the number of people in the meeting. Okay. It appears that we're almost there. Oops. Okay, so here we go.
Well, thank you. Thank you, Sean, for doing that, and welcome everybody. So this is just about COVID-19, and this is not a real long thing, but just to kind of get us started on some of the questions that you might have. So next slide.
Okay.
And so this is for me, a part of a school project. So I had to make some objectives by the end of the training, be able to list 4 safety measures for school opening, be able to state who is considered a contact of someone with COVID-19, and be able to state when an individual will be sent home from school because of COVID-19 safety measures. And then since this is a school project, then I had to have an evaluation attached to. So here's the link for the evaluation, and it would be lovely if you could fill that out for me.
What I will do for everyone is to copy and put that in the chat box at the end of the session so we can get some evaluations in for Dawn. So don't worry about trying to get that information right now. It's also listed at the end of the presentation, and I'll put it in the chat box. So, okay.
Yeah, I don't think it's not a real long thing. So I think we probably are all tired of hearing about this, but I'm just going to go through this list of symptoms of COVID-19. So fever, chills, cough, shortness of breath or difficulty breathing, fatigue, muscle or body aches, headache, new loss of taste or smell, sore throat, congestion or runny nose, nausea or vomiting, or diarrhea. So that is a long list, and it overlaps with a lot of other illnesses, flu, allergies, colds, stomach problems. So we know that it's going to be pretty tricky figuring this out, but just that we have this list and we can identify those symptoms.
We know what we're looking for. Yes, thank you.
And then, so what the first thing we're going to do for health screening for both students or staff is going to be passive screening. So that's going to be at home. We're going to check our temperature and look for COVID-19 symptoms, and we would stay home, or a student would stay home. If our temp is 100.4 or higher, any COVID-19 symptoms, been in contact with someone with COVID-19, have been diagnosed with COVID-19, have been told to isolate or quarantine, or have recently traveled outside the United States. And so then at school, we're going to do active screening, check temperature, ask student for any symptoms. So I think how we're doing that is just, asking them if they feel well, or rather than really asking about each symptom. And then look for signs of illness, just, flushed, pale or whatever. Then send home if their temp is 100.4 or higher, or if they have any COVID-19 symptoms. And just as an aside, I wanted to say that on those non-contact forehead thermometers, really their forehead should be dry and visible. So if their hair is down over their forehead, you need to ask them to move it up. And then if they're real sweaty or something, ask them to kind of dry it. So we're going to get more accurate readings doing it that way.
Okay, yeah, I just have a couple comments on this page. First of all, this is the standard throughout the state. Every person, whether a staff member or a student, is asked to do that passive screening at home before they come in, and if any of those things are there, don't even come to school. And then in addition to that, we're going to do those active screenings at school. Right now, what you're all used to if you've been coming onto school campus are the little handheld, touchless, temperature taking guns. However, we have ordered, to assist with return to in-person learning, automated temperature scanning stations where you walk up and it automatically takes your temperature without anyone having to hold something up. And some communication just went out to principals and administrative assistants today with the directions or the guide for those. They'll be here November 1st, so we'll have some time to get them in place and test them out prior to November 16th. So those are on the way. That will assist and hopefully make it a little more efficient to take temperatures for students coming onto campus.
Okay, and then so the safety measures that we're using at school, hand washing and hand sanitizer, face masks, respiratory hygiene, 6-foot distancing requirements, cleaning and disinfecting, and ventilation. So I think probably everyone's had this experience when at home when we were getting used to the idea of having to, wash our hands more, wear masks and that kind of thing. We were kind of fumbling around, my husband and I, and trying to, incorporate that into our routine. But we did do that, and it's gotten a lot easier. So I'm hoping that that's going to be our experience at school too. For the hand sanitizer, if kids put their hands in their mouth a lot, then we probably should be using soap and water with them rather than the hand sanitizer, unless we just don't have any other choice. Because there shouldn't be a lot of that going down your throat, and so and then the younger kids would then of course have to be supervised to make sure that they're not messing with it. And but it is okay to eat using your hands after you use hand sanitizer. And we're going to be washing our hands upon arrival, before lunch, before leaving a site, upon entry to any new classroom, when using the restroom, when our hands are visibly dirty, after using a tissue, coughing or sneezing, and upon arriving home. And then talking about face masks, so those should be the cloth or disposable type that should cover your mouth and nose, and you should not really have to be touching it. So if, they really need to fit, because otherwise you end up having to just keep adjusting and repositioning. So that is less ideal. If it has one of those nose bars, the metal thing that goes over your nose, if you push that down a little bit so it more form fits to your nose, because I see people not at school so much, but in the grocery store where they didn't do that and it's like falling off, but really they fit better if you use that. So in the health and safety plan, it says they should be worn when entering or exiting school grounds or district spaces, while on school grounds with a few exceptions, while on the school bus, engaged in work, whether at the workplace or performing work off-site, when interacting in person with any member of the public, or working in any space visited by members of the public, regardless of whether anyone from the public is present at the time. And masks, the cloth type, need to be washed at the end of the day. And then the list of when it's allowable not to wear a mask: if you're alone, if you're eating or drinking, but then you need to be 6 feet apart, if a physician says not to, or if it's not developmentally appropriate. So
a note about the masks too. Some people have asked, will there be masks available? Absolutely. We have a new mask every day for every staff member and every student if they so desire or need it. Of course, just like with pencils and crayons and everything else, we would encourage families or students to bring their own. Plus, they're probably more comfortable with it and used to wearing their own mask. But if not, that's not, we have plenty of masks available. So thank you for that, Dawn.
Okay.
Oh, I think, so you said something there, if there was a doctor's note that says it's not, a student may not be able to wear one, and that might have raised some people's awareness levels. So we did receive guidance from Dr. Kerr if that were the case, and we don't expect that to be very many children at all, but there could be a medical condition that required it. We would then ask them to wear a face shield with a drape, okay, if they can't wear a mask. And if for some unknown reason they couldn't even do that, then we would move to put up some plexiglass around them. Just, again, protective measures, preventative measures, and these will each be dealt with on a case-by-case basis. If a note like that comes in, we want to get that to Dawn, to our nurses, or get that up to your administrator, I guess, and they'll pass it along, and we'll make sure we take all precautions necessary.
Okay. So then compliance. So what about those students who don't wear masks appropriately, or they intentionally don't stay 6 feet apart? So we're going to remind or ask them to follow the rules, and we're going to use a progressive discipline approach. And students repeatedly not following safety measures will be excluded from attending in-person instruction and assigned to full-time distance learning.
Yeah, so obviously it's critical that we follow these, and it's for our safety, and it's for us to be able to continue to offer in-person learning, and the mentality here is not an out to get you approach. Obviously, we want students on campus and we want them to be safe, and we will have to provide reminders. It's really about building a culture of doing this. Like, hey, if we want to stay here, if we want to continue to be here, we need to wear our masks, or we need to stay 6 feet apart. So we want to have a progressive discipline approach and work with students, but ultimately, if they're just proving to us that they cannot follow those, then the in-person model will not be appropriate for them, right? And we'll have to assign them to distance learning due to their inability to do what we need them to do, what we're required to do. So.
Okay.
Before you go to this slide, Dawn, I would just like to mention we're going to have a question and answer session at the end. When I'm sharing or presenting my screen, I cannot see the chat box, and so I'm understanding there's quite a few questions in there. If you could please take some notes and save your questions for the end, and that way we'll be able to make sure everyone's questions get answered. I don't have the ability to see the chat box right now, so just want to make sure I call that out there so you don't think we're ignoring you or not being responsive to questions.
Okay, so then disinfecting. The custodial staff is going to do cleaning outside of school hours and on Wednesdays, and then additional classified staff may assist with disinfecting. And each classroom and common area will have spray disinfectant and hand sanitizer. And then just to remind you that cleaning is like when you wash with soap and water and rinse, and then disinfecting is when we use the spray disinfectant, and then that has a dwell time, which I'm not exactly sure what it is, how much it is, but it's some minutes probably. And then we, normally you would not rinse off the disinfectant.
Thanks, Don. Yeah, sometimes the term cleaning and disinfecting get kind of commingled with each other, but there is a difference. And yeah, like it says there, the cleaning is done after school hours, either before school, after school, Wednesdays, deep cleaning, outside of the hours when students are present on campus. Disinfecting will happen regularly throughout the day, which is really, like you said, spraying a disinfectant, and most of them are fast acting, and as they're drying, they're doing the disinfecting, so don't require to be wiped down. So that's an important distinguishing characteristics between disinfecting and cleaning.
Okay. So then we're going to just go through some of these different scenarios. So what happens if student or staff has symptoms of COVID-19? So the student or staff member is going to be sent home, like we said before, and we're going to recommend that they contact their health provider or public health for testing, and that their cohort would stay open.
Yeah, I think this is the part to the training that seems to be getting the most questions, or what happens if, or what about this, or what if that. And so this is just for the symptoms, and this is going to be tough as we're entering cold season, flu season, right? We're not going to have a way to know if it's just a cold or if it's a symptom of COVID. So the student has to go home. And that, could mean a lot of kids having to go home during this time of opening up. But that is, we're not going to take any chances and say, oh, it's probably just a cold. Obviously, we cannot do that. But in that case, the individual student with the symptoms goes home, and the cohort or classroom stays open.
And then the next thing, I've been hearing this a lot in the news, so you probably know, but just to say, a person who's been within 6 feet of, or less of someone diagnosed with COVID-19 for at least 15 minutes is considered a contact. And I heard on the radio, I think today, that really the 15 minutes doesn't have to be consecutive. So it didn't even occur to me. We're 6 months into this. I didn't even think of that possible issue, but that does make some sense.
Okay, yeah. So there's one of your hint. There's one of your quiz questions at the end. Some of our objectives. Who is considered a close contact within 6 feet for at least 15 minutes or more? And then in that case, that person. Well, I think that's on the next slide. So let me hold off.
Yeah. So then, what happens if a student or staff member is a contact of someone with COVID-19? So the following: stay home or go home. Send a report to the school administrator, contact the healthcare provider or public health for testing, so we recommend that. And then their cohort, again, would remain open. And I think we also have to consider other people in their household because, if they could be contacts too, so we just have to kind of think, about that particular person, but then also who else is in their household. And we're going to be reporting these to public health. We're going to be staying in close contact with public health so that, if they haven't heard of this person, they can follow up and help us to figure out exactly what this particular situation needs. And there's a process for that, so that there's administrators that are going to be calling public health rather than me and you and, the principal, and we're going to keep it to a small number of people so that the communication is good and we're not inundating them with phone calls.
Yeah, so actually, if you're wondering who those people are, any student issues, I am the point of contact with our public health, and any employee issues, it's Dave Vicari. And we have worked very closely with Dr. Kerr and our Amador County Public Health Department in the development of our plan, our health and safety plan, and all of these guidelines. Actually, everything that's on this slide and this whole protocol is based on the California Department of Public Health and state guidelines. So we have to follow those, and this is exactly based on that.
So then what happens if the student or staff member does test positive for COVID-19? So they, of course, would stay home or they would go home. We would, again, send the report to the school administrator. Family contacts, healthcare provider, or public health for testing for individual and family. Family quarantine for at least 14 days. Closure of cohort for 14 days from last exposure. And immediate shift to distance learning, and then confidentiality maintained. So we got to remember that we're not spreading around this information. It's people's private health information, and so we have to keep that confidential.
Yeah, so if there's two scenarios here. If it's a student who's tested positive, then yes, that entire cohort and the entire class does go home for 14 days for distance learning, and the teacher continues teaching and the class continues learning in the distance learning format for that 14 days while they can't come to school. If it were the teacher who tests positive, well, then we have to put in a substitute teacher in place, for them to continue, and all the students are home for that 14 days of distance learning during that quarantine time. And what happens is communication goes home to the class. We have all these letters ready to go in English and in Spanish. And again, the confidentiality piece, obviously it doesn't say which student, it'll just say a student in your child's cohort or class has tested positive for COVID-19. Therefore, the class needs to be home for 14 days. We would like you to contact your healthcare provider for testing. And that's, at this point, public health gets involved and they start all of the contact tracing. And we really kind of turn things over to them for these cases here. Work closely with them, but they do a majority of this piece for us.
So then what happens if a person tests negative and they've been in one of these three situations? They have or had symptoms, they're a close contact, or they tested positive previously. So in that case, a student or staff may return to school 3 days after symptoms resolve. However, if they're in close contact with a positive family member, they need to have at least a 14-day quarantine, even though they have a negative test, because they're in continual contact. So they're being, their exposure is ongoing.
And yeah, in this case, the cohort remains open. So this is important. Anyone who's a close contact, even if they test negative, they still have to stay home for that 14 days. Just because they had a COVID test 4 or 5 days into it and they test negative doesn't mean they get to come back. Anyone who's defined or, identified as a close contact stays home for that entire 14-day quarantine period. So
let's see. And then when would an entire school close? So if a student or staff member tests positive for COVID-19 and there's been significant mixing or contact with other students in other cohorts. And then, so if someone becomes ill during school, starts having symptoms, then, and that could be student or staff, they would need to go to the isolation area to wait to go home. That could be outside. It could be an empty classroom with chairs 6 feet apart, or an area in the office. And principals will be arranging, and I think a lot of you know where it's going to be. And then when in isolation, people should have on a disposable mask unless they, unless it's someone who just can't. But that's a small number. Then they should have a bathroom available, water and tissues available. And again, we recommend but can't require that they get tested for COVID-19. And there'll be an information sheet to send home with student or staff that has information about when they could return to school.
yeah, that goes home with that letter that notifies them on what to do. Here's what you need to do. It's all written out so that they don't have to remember something they were told by a staff member at the school. It's all clearly spelled out for them.
And then we were going to clean that area once they leave, just to bring that up.
Yeah, absolutely.
So staff for isolation areas, we're going to use standard precautions. So remember, standard precautions means that you can't really identify who's contagious. So we just, act as if everyone is contagious in that room. So we're going to wear a disposable face mask, wear a face shield, wear gloves. And then gowns and face shields with capes are also available. And gowns I would wear if I felt like there was a chance of somebody getting some body fluid on me. So might not always need that, but it probably wouldn't hurt in those isolation areas. And then of course we're gonna try to maintain that 6-foot distance as much as possible.
Yes, and again, all the personal protective equipment is available. You don't have to worry about accessing or purchasing that. We have all of that ready to go for that needs it.
We have 1 foot times 2 hours cut. I don't have no idea.
Could someone, could you mute yourself, please, ma'am?
And 2 nights custodians down, is that what they're saying?
Mm-hmm.
I don't know what the FT is. Full time.
Is there that could mute yourself?
Lisa, you want to turn off your computer?
Lisa, yeah. Lisa, turn off your mic.
Thank you for your help, whoever did that. Okay.
Okay. And so then kind of along those same lines, there are staff that is providing personal care to students. So that's mostly severely handicapped, but that kind of goes with the last one where we're going to use those standard precautions and wear disposable face mask and face shield, or the face shield with the cape, wear gloves, wear a gown, and maintain 6 feet distance as much as possible. But we know that isn't entirely possible if you're changing somebody's diaper or something. So then, but that's why be sure to have the equipment.
Okay, thank you.
And then removing PPE. So we were putting on this equipment, and then again, we're using standard precautions. So we're just, we don't know who's contagious. So we just do the same thing every time. Remove masks by straps, remove gloves touching the outsides as little as possible, remove face shields by the straps, and gowns, touching the outside as little as possible. And then put those items directly into the garbage. Don't set them down somewhere to put in the garbage later, but and then be sure to wash your hands. And any time that you take off gloves, of course, you got to be washing your hands. And we just consider the outside of gloves and gown to be contaminated, and shields. And I sent out to a few people some information sheets about putting on and taking off equipment. So I can send that out more widely. If I think I kind of hit the people that are going to be doing the personal care anyway. And then cleaning up eye shields. So that's supposed to happen if they're visibly soiled, or at least daily. So kind of like masks, but we can't just throw them in the wash. So you're supposed to put on gloves, carefully wipe the inside, followed by the outside of the face shield using a clean cloth saturated in neutral detergent. So that would be like soap and water. And then carefully wipe the outside using a wipe or a cleaning cloth saturated with the EPA registered disinfectant solution. So I think that's the spray bottle stuff.
Yeah.
And wipe that down and let it dry. And then it's probably going to be cloudy from doing that. So you can take some cloth with clean water and just wipe the residue off, or alcohol could be used for that as well. And then dry fully, either air dry or with another clean cloth. And then remove your gloves and wash your hands.
So that's for washing the face shields, correct, Dawn?
Right.
And the disinfectant will be available in every classroom, every common area, the office. So there's plenty of disposable bottles and access to the disinfectant.
So
I have a question.
Oh, we're almost finished, so we'll take the questions right at the end. Thank you very much.
So just we're just gonna try to follow these guidelines, and so that we can safely return to school, and remember to maintain your precautions and work together.
Okay, so I'm going to copy and paste this into the chat for you all. Whoops. To do the evaluation, and then we'll get to some questions and answers.
Right, and thanks again for helping me with my school project.
All right, now I need to stop sharing my screen. Okay, there. Now you should be able to see me again. Is that better? Okay, let me put the link to the, I'm going to paste that in. And there's 246 people in here. So, oh no, I'm still presenting. Now that's better. Now I've stopped presenting. So there's the link for the evaluation. Thank you. And thanks, Rand, for telling me that. So there's not a hand raising feature in here, but I guess we'll just take some questions as they come in order at this time.
I have a question.
Sorry, I muted myself. Yes, go ahead.
Hi, it's Leah. When we, in our classrooms, if people discard anything that they've touched on the way out the door in the garbage can, are we going to have separate garbage cans that will be maybe covered or something for anything that kids have touched, and like any PPE, that kind of thing, or is it just going to go in the regular garbage can with everything else?
I haven't seen anything in the California Department of Public Health guidance as far as separate garbage cans or things like that. I know it's not treated like the Sharps containers or the hazardous materials containers. So there's nothing in the guidance that dictates that. So at this point, we don't have a plan for separate containers, Leah.
Okay, but it would be okay if we designated one in our own classrooms just in case?
Yeah, I would think, yeah. I know many
Okay.
classrooms do have a couple of garbage cans. So if you want one
Yeah.
for masks and, masks really would be the PPE that they might discard, then absolutely, yeah, that would be fine.
Okay, great. And just one quickly, I'm calling in, so whatever you have cut and pasted into the task or into the chat line, I don't have. So is it possible that those could be emailed as well?
Yeah, absolutely. What I can do is I emailed everyone this morning a little update on today's training, so I can send another email with, here's the link to the evaluation.
Okay, great. Thank you.
Yeah, thanks for the question.
Hi, Sean. It's Tara Hanna.
Hi, Tara.
Hi. I just have a question, and I might be misunderstanding because I came over a little late from another meeting. I was on Avid all day, but I think I heard you say that if a student in the class gets COVID, then the students will not return for 14 days. Did you say the teacher would stay teaching?
No, so the whole cohort is what they call it. The whole class or cohort goes home for 14 days, including the teacher, but the teaching continues just in a distance learning format. So then you're teaching from home, the kids are learning from home, but we have to continue to provide that, teaching and education in the different format.
Okay, perfect. And then if the teacher does become sick and the teacher cannot teach, are we covered for that? I saw that a lot of questions about that. Does the district pay for the subs, or do we get penalized for that?
Yeah, no, you know what? I am not the expert in all the different leaves for if you're a quarantine. You're still working, so you don't have to use sick leave or anything if you're on a 14-day quarantine because someone in your cohort tested positive. So, but unfortunately, I don't have the answer to, how we'll get a sub if it's the teacher who tested positive or if the teacher gets sick. The answer to your question is yes, we'll provide a sub. Our human resources department would have to provide the specifics on how that gets, charged or docked or whatever you want to call it.
Okay, thank you.
Well, Sean, how does that work at the secondary level? Because we don't have cohorts at the secondary level. We see about 100 kids during the day. So there's
this is a challenge with, I've seen one high school, I think it was Community or Capital Christian or something, where we're not mixing cohorts at the high school level or the secondary level. If you're in a high school, it's really hard to get all of your, to get 30 kids who need all the same classes for graduation and keep them in one room. And so there's a higher likelihood at secondary if a student tests positive that a good chunk of the students may have to go home or the school may have to close down. But with that said, now last week, and this is an example of that ever-changing guidance from California Department of Public Health, right? We know it's changing all the time. Now they're saying, and this is what, I don't know if you can see my screen, this is straight from the California Department of Public Health. This was their updated guidance on July 17th, and this is still in effect. Now they're saying maybe the whole cohort wouldn't go home, but they would get into the in-depth contact tracing to really find out who that kid had been in contact with and have those individuals stay home instead of having the whole school or the whole cohort stay home. So that's a kind of a long-winded answer, Matt, or a long around-the-bout answer. But at the secondary level, especially high school, if you have a student that tests positive, they will have come into contact with a lot of kids. So it'll be challenging.
And Sean, I'm going to jump in. This is Christine Kikafer, occupational therapist. I'm on 8 different campuses with 40-some students. So if one of my students has a classmate who comes down with COVID, what happens to me? Do I?
If a student so in that case, if a student has a classmate that came down with it, the student could be considered a close contact. You would be a contact of a contact. And in that case, the guidance just kind of says, you're fine as long as you don't have any symptoms. If you have symptoms, then you need to go home. So that's the whole contact of a contact guidance. That's part of this chart here. And I want to, sorry, as long as I'm thinking of it, I meant to say this earlier. This is all on our district website. I know it's, people might say, oh, just go to California Department of Public Health, or it's on the internet. We've put all of these documents that are part of this guidance on our website under coronavirus updates, and it's under family resources. So this is there. The health and safety plan is there. The whole California Department of Public Health for schools reopening recommendations are there in case you're interested in any further reading or really looking in depth at it.
And there's the appendix papers that I think are pretty helpful. They're, kind of easy to read. They're well laid out. So I printed that out just to have a reference.
And then Dawn, do you know, because I was told this yesterday, that I can't go on to more than 2 campuses in any day. Is that something from Dr. Care, or is that coming from the state?
So I asked her about that because I do that too, go to one campus, then go to the next. And she told me that as long as I have my mask on and I haven't been within 6 feet of anybody, that I'm not a contact and I can go to the next school.
I'm in with 6 feet because I'm with Mod Severe, so I'm in full PPE,
Right.
and I also have district students who I see just like for handwriting. So that's a huge concern, is cross-contamination for me.
Right.
That's a good question, Christine. And some of those real specific ones like that, I would like to email Dr. Kerr and get a definitive answer. And that's an example of, I said at the beginning, we're not going to have all the answers, but we have to work with public health. This is the guidance we're following, what the state's given us and what our local public health officer gives us. So I hate to ask you to do one more thing, but if you might put that into an email, I'd be happy to forward it to her.
Sean,
I have a question too.
Okay.
This is Christine Bakovich, librarian in Ione Junior High.
Yes.
Hey, how's it going? I see about maybe 300 students that come in and out of the library to check out books. And so what I'm trying to find out as a classified staff member, I wanted to find out if the children are coming in and checking out books, they're obviously going to be coming within 6 feet of me. Am I going to have to use my own sick pay and sick leave single time I'm exposed to a child that has, since we're mixing cohorts in that situation, COVID-19?
Well, actually, I would like to get some clarification before we even get into the leave part or your sick leave part. I think an email to Dr. Kerr about the whole checking out books, right? Should we be doing that? Because we're coming back for in-person in a hybrid model. Does that include checking out books in the library? I can think of several things why that might not be a great idea. Obviously, we want our kids to have books in their hands. We know that, and that's been a challenge having them at home and the inability to do that. But I'm not sure that that's something that she will be in approval of. So I need to ask her.
Well, we are currently checking out books to students, and they are bringing them back, and we just sanitize them. So we might need clarification if there's certain books, how long we would have to sanitize them for. Should we put them in a separate area where there's nothing touching it for a certain amount of time? Or so I guess there's a 2-part question I need answers to if I can.
Yeah, and I think the way we're doing it now under curbside pickup is different than what you described as, kids in the library coming up to the counter for you to scan their book for them to check out. So I would like to get clarification on that. And then, yes, what you mentioned would still be the case of what we would want to do. We did get some clarification from her just a week or 2 ago around, what do you do if you have to deliver materials even to, the paper packets? Is it safe to walk it up to the porch for a student who may be even at home with COVID, a positive COVID case? And the answer is yes, you can set it on the porch with nobody else being out there. But you don't touch those materials, like you said, for a certain amount of time, and you sanitize and all of that. So,
Sean,
yeah, my concern would be just the amount of sick leave that classified staff members, having that exposure with so many kids, how we would utilize our sick pay, because we're going to run out really quick if we're having to use 14 days of our own because of exposure to someone else.
Yeah, no, I know there are some Coronavirus Act type leaves. And again, I'm not the expert in all of those. I know our Human Resources Office is pretty familiar with them. So that would be, I would have to defer to them for that answer. I'm sorry, Christine.
Sean, this is Rayanne. I have a question regarding lab classes like culinary or science or ag that do group lab classes. I haven't. I've been reading through all the documentation and through the Department of Education, and I haven't seen anything super specific. It's been very general. Should we not have kids in group labs, and should they just be individualized, or should I just do a demo? I've been very concerned about that, thinking forward and trying to plan and trying to budget, for 140 kids, doing individual labs. And then if I do it, I've had 2 back surgeries, and, doing all the prep to buy all the stuff and then to package it all, that's a lot.
Yeah, those types of situations, science classes, culinary, like you mentioned, ag, where there are the labs like that and students could be sharing equipment, students could have to come within 6 feet of each other. I do not believe we'll be able to do those. We know even with athletics, they've been able to resume conditioning, but they can't share footballs, they can't share basketballs. So, if that's the case for athletics, that would obviously still be the case for a spatula or cooking utensil or things like that, anything that's shared. But I think this is a good one to get some clarification on. The industry guidance hasn't been specific to culinary classes or science, things like that. So
What about art?
If there's sharing of equipment, I think it's going to be, I don't know that would be approved. It's all about multiple students touching the same equipment, unless it can be sanitized in between. And in that case, she's been approving of that. But though art is another one. So I think what I'm starting is kind of a frequently asked question or just a Q&A document of these types of things from Dr. Kerr so that I can email, get the answer, and put it in a document so that all of us can see those answers. And we'll get that up on the website as well. I think, it's stuff that we're all wondering about now, and how can we make this happen when November 16th hits? Or can we? Can we or can't we?
Thank you. I appreciate that, because I've been stressing over it and trying to see the language, and I haven't found anything. From other states I have, but not from here specifically. I guess they're kind of leaving it up to the individual areas and districts. So I appreciate it.
Yeah, California's guidance is different than many of the other states, and that's what we do have to follow. And we, Dr. Kerr is in line with what the state public health officer is enforcing and won't be any more relaxed than that. So I will get clarification and get, like I said, get that document for everyone to be able to see. Thank you.
Hi, Sean.
Hey, Sean.
You mentioned a date just a few minutes ago. Can you repeat that date again?
November 16th is the date where we're resuming in-person hybrid model of instruction.
Okay, what about the October 19th date?
Yes, for severely handicapped students and the at-risk cohorts of students. That would not really, I don't see students coming in the most at-risk students for like a science lab or to do a culinary class. Really, we're talking more about students with disabilities and our English learners, and for more targeted academic interventions on October 19th. I know SH might be doing some more specific things. So on starting October 19th. So if you're thinking labs and sharing of equipment, we will definitely need to talk more about that, Amy.
Okay, because we do have students that are on the list that have some of those classes.
Okay, that they would mainstream into some of those classes, you're saying?
Yes.
Yeah.
A lot of the students that I work with go into mainstream classes.
Yeah, that mainstreaming will not, if it's in person, won't be available until November 16th, because that's when the rest of this people come back for the in-person hybrid model.
Okay.
But if you have specific questions, Amy, we can take that offline or talk a little more about that if you'd be more comfortable. Yeah, go ahead, Brett.
So first, I hope you at the end of this download the chat and take that to your leadership meetings. Number two, you keep referring to Dr. Kerr, which I understand in terms of like making a determination for our county health decisions, but the district leaders are going to have to fill some of those gaps on very specific questions we have that she's not going to be able to answer. So I would really recommend, if you can, which would hopefully include our Dave McCary, have a subsequent meeting where you guys review some of these questions, because there's a lot of really important questions here that I don't think are just going to be able to be addressed by Dr. Kerr, but where we have to make some decisions on and really get back to us in really clear directives on what we're supposed to do.
Okay, yeah, like I said, I could not see the chat the entire time where I was presenting. So, and you're probably talking more specific to leaves or what, do we use our sick leave for this and things like that? So thanks for the suggestion, Brett.
Sean, this is Catherine Brown. I am recording all of the questions, and if we're not able to answer them in the next 12 minutes, we will be sending them out to you once we have them answered.
Okay, thanks. Yeah, definitely the health ones, all of these, I want Dr. Kerr to weigh in on, but point taken, Brett, about the leaves and things like that.
Hey, Sean, can I jump in for a second?
Yeah, Dave, please do.
Okay, I just want to let everybody know that you can look up the Families First Coronavirus Response Act. That's employee paid leave rights. And some of the questions that I heard, and I just got here a little bit ago, so what this act provides, that employees are covered if you're eligible up to 2 weeks, up to 80 hours of paid sick leave at the employee's regular rate of pay where the employee is unable to work because the employee is quarantined, and that's, pursuant to federal, state, and local government law, and or experience COVID-19 symptoms and seeking medical diagnosis. Then there's also up to 2 weeks, 80 hours of paid sick leave at 2/3 because the employee, is unable to work because of a bona fide need to care for an individual subject to quarantine, which could be, or care for a child whose school or child care provider is closed or unavailable for different reasons. So with that 2/3 that's paid for that specific category, you could use 1/3 of your sick time to have full pay for yourself. So that's what I would recommend everybody do, is take a look at the Families First Coronavirus Response Employee Paid Leave Rights Act, and then we can have another conference around this or another meeting if you like to. But it's pretty explanatory.
Yeah, and the only unfortunate thing about that program is it's only for 2 weeks. When you have an ongoing medical problem at home that you can't return because of, that's only 2 weeks.
No, that is two weeks, but there are the Employee Family Medical Emergency Act. You only get that once, but yeah, you're right. That is specific to COVID, and it is for 2 weeks.
And that's
but
it.
We do have other leaves available for specific, in specific instances. Anyway, thanks, Sean.
Thank you, Dave. Yeah.
Sean, I have a question about parents that don't go by the guidelines of keeping their kid at home. Or how are we holding them accountable so that they don't? I know it's just a small handful of parents that may do that. I'm just curious so that we don't have the system fail in the future.
Yeah, we know that, you're probably referring to parents who give their child some Tylenol and send them to school, so that they can get through the day. And it's very clear, like any symptoms, we will send them home. If they come to school and they have any of the symptoms that were on that first slide, we have to send the child home out of precautionary reasons. And it's going to be unfortunate. Like I said, we're entering cold season, right? So a student comes with a cough, well, we're sorry, but you have to go home because we don't know. So we're not going to take any chances. And if there are families who are repeat offenders and we're having difficulties with, again, it'll come down to, maybe the in-person model is not right for your child. And so we're going, we'll need to assign them to distance learning. This is the third time you send them to school with symptoms or whatever. Just giving an example, not that it would take 3 times, but we do have distance learning at our disposal. And for situations where the in-person is not working and they just can't do what we need them to do, the unfortunate reality will be that that's going to be their option then from that point forward.
Does that include staff that do not follow guidelines?
That's a good staff that do not follow those guidelines. We will work with them through with each administrator, I think, and their immediate supervisor for that. Because certainly, yes, that's a good point. We need everyone to do this. Like I said, it's about building a culture of and modeling for our students what we need to see from them, right? So we can't have staff coming like we used to when, it's easier to come to work sick than to do sub plans and get ready for all of that. though we can't do that anymore. You know, we have to be home if we have any of those symptoms. So I can't tell you, Nikki, that I would say, nope, sorry, you're assigned to distance learning, but we will definitely work through the process and work with your immediate supervisor on that.
Are we, for students with IEPs, is it legal to bar them from in-person instruction? Because, you know, if they're not, I know there's certain groups like my class that won't be able to wear the masks, but I'm concerned that parents will send their students to school sick and then we'll give them warnings and warnings. Are we legally allowed to bar them from participating in in-person instruction in that case?
I do not honestly know, Michael, the answer. Obviously, this is a new thing, right, that people are just starting to deal with now as kids are coming back onto campuses. And I know there are several lawsuits. There's a lawsuit against every district in the state of California right now related to special education, and there's a national one as well. So I would like to look into that before I answer your question so I don't give any false information.
Sean, how many subs do we have on the sub list currently right now active? How many subs are on the sub list?
Hi, Stephanie. Thanks for the question. I don't know if Dave's still in here.
We currently have 70 subs on the sub list, and tomorrow night at the board meeting, what we're doing, we're temporarily increasing the sub rate from $110 a day, excuse me, to $175 a day for substitutes, because obviously subs weren't that excited to come back and sub during this pandemic, but that we've had a great response from them. And in coordination with the Ed Services Department, we are training our subs on the how to substitute during distance learning and hybrid model both. So we're getting a lot of really positive responses from our subs. In the past 2 weeks, we've added 11 subs to our sub list.
Okay, so is there any concern at all that, I mean, in the past, and it's happened over and over again, it's just something that happens, but sometimes you come to school, there aren't any subs, so teachers will absorb those students, but that's not going to be an option now. We can't absorb anybody else's students. So will we have a plan in place if like somebody gets sick and there aren't any subs? What would the plan be? Would you just contact your cohort and tell them distance learning today, or?
Well, Stephanie, we need to obviously coordinate that, you know, on a site-by-site basis, but we are hoping to have subs available because we're not going to have the professional development and athletics really going on right now, and a number of other things that take subs or take teachers out of the classroom. So we're really anticipating that we'll be able to cover when we need substitutes, although, you know, it's not 100%, but we really feel like with the amount of things we're not doing now during the school day that you guys have been asked to do, that when somebody's out sick, that we can manage that.
Okay, thanks.
Sure.
Thanks, Dave.
What about?
Wait, Dave, one more. When you said that there's 70 subs, are you including classified or subs along with
No, I'm not,
custodial
Robert.
staff, kitchen staff?
No, Robert, we're not. That is, that's an area where we do not have a lot of subs. We are advertising for substitutes, and just, for example, custodians. We have a hard time filling our custodians and M1 positions, as you know. So that is an area that is still lacking.
That was another question of mine was, I know Amarillo High is short 2 night custodians, Argonaut short 1 night custodian, Trillia is short their maintenance. And
Trillium,
then the
that's
rest
been
of
hired.
Okay, cool.
Yeah. So yeah, they're posted. So if anybody knows anybody that would be interested in a custodial or maintenance position, we definitely have availability.
Okay.
So, all
I
right.
have a
Thank you.
follow-up question about the subs, the certificated subs.
Okay.
What precautions are going to be put in place for subs who say sub at elementary school one day, the next day sub at a high school, maybe the next day to junior high? The potential for, and even if they're following all the rules on paper or not, I mean, we won't really know, I guess. But, you know, that seems like it opens itself up to quite a few exposures around multiple cohorts in schools. So what's Is there something being written for that?
Well, we do have the self-check that everybody has to do when they come to school as far as temperature, any type of symptoms. And we have a number of itinerant employees that are full-time with us. We have bus drivers that take many different kids, food service come in contact with all kinds of different kids, school nurses like Dawn. So we are counting on them to check themselves and take steps if they think that they're not sick.
And Nikki, part of it too is based on where we're at as a county right now. Like that, none of this would be allowable back when we were in the purple tier, right? And so, the fact that it has to do with your local epidemiology, as Dr. Kerr refers to it, and so using the precautions, wearing masks, staying 6 feet apart, frequent hand washing, disinfecting, things like that. The state guidelines tell us that is acceptable and okay for people to be able to do. I understand what you're asking, but
sure. Yeah, it does seem like it would complicate contact tracing if there is some sort of outbreak at one of the high schools and that person's also been subbing at middle and elementary level. I just had another thought, but I forgot it.
That's all right. It'll come back.
I have a question about when we may or may not shuffle teachers and classes based on the teachers that decide to go out for medical reasons and stay on DL. When will we know that information?
Okay. So you're talking about the whole process of determining who comes back and when and what people are going to be assigned to. That is on our timeline for the week of October 19th. So the week after October break is when the kind of the restaffing or shuffling would happen.
Thank you.
You're welcome.
This is Sean. This is Mrs. Barney. Katie.
Hi, Katie.
Hey, with that timeline, then are we kind of looking at another 1 week's notice as to what our potential assignments could be? And is it possible that our schedule, our periods of what we teach, and how the on-site schedule could be completely different than what it is now? And can we kind of basically assume we're not going to probably have a lot of time for lesson planning for this new change? That's what I'm trying to say.
Yeah. Okay. So there's a couple things there. The plans I've looked at, I mean, it depends on what ends up happening, but some of those things, because they have to do with working conditions, are subject to negotiating. And so we're actively doing that. And so I don't have a definitive answer for you at this time, other than to say we're working hard on that. And we want to get that out to teachers just as soon as possible and give you as much time as we possibly can if there's going to be changes to get your plans in place. I don't know how helpful that was, but that's
Yeah, I'm trying to visualize ahead of how many, besides this change of going to campus, what other logistical changes in terms of our actual schedules would potentially, would be different.
Yeah, the solutions we're looking at, we hope to be able to keep master schedules intact. I mean, we know how challenging it would be to blow up a master schedule right now, or even for second semester, right? So we really want to try to be able to do that if at all possible.
And just real quick, and I know this is probably not so much health related, but just I am hearing a lot of students in my own classes that really are truly saying they are thinking about distance learning. And I know that's not official, but I do think it's really important to note that we could potentially have a class period of students who the majority want DL, and then we're going to campus for 3 kids. So I'm just kind of want to put that out there, is that it could be obviously an issue in terms of how we're going to plan for, less kids now than we normally would if we had them all at one time. So, and I don't know what the survey results are when we know all of that, but I'm kind of worried, for my AVID students, if I have a lot of sophomores that aren't doing it, and then it's, teaching with three kids potentially could be interesting to say the least. So just something to think about.
Yeah, thank you, Katie. So the opt-in form for distance learning for families will be going home this week. It's, we said the week of October 5th, and so hopefully that'll go out tomorrow. And then we're going to give, the original deadline was going to be, we wanted it by this Friday, but we know we had hoped to get it out Monday, and now we're kind of waiting on a few things before sending it to families. So we're going to extend their deadline to the end of October break to really give families some adequate time to think about what option is best. And so to answer your question, we really won't know that information until we see what those families want, right? So once we have our the families opting into distance learning, then we can start looking at how they land with each of your sections at the secondary level or at elementary, each classroom, and how we're going to divide that up. And that, so that's really a key next step.
Thank you.
Thank you.
Sean, this is Jackie Holtz. I had to leave the room for just a second, so I am very sorry if this has already been answered. But with elementary school, the elementary classes, if we have an A group and a B group, and the A group is the one that gets COVID, does the B group have to go home too for distance learning?
The guidance from the California Department of Public Health says the cohort.
Somehow I lost you.
Oh, sorry. Can you hear me? So you're saying if a student in a class was a confirmed COVID-19 case, the school remains open, which is, yeah, that's obvious. But I'm going straight off of California Department of Public Health here. My understanding is because the teacher would be a close contact, right? If the student was in your class, both of your cohorts would go home. So your A and your B would go home and go to distance learning for 14 days. And, you would teach from home and the students would learn from home.
My sound just went out for hearing you, so I will watch the video.
Or I'll give you a call, Jackie. How's that?
Well, Jackie, hi, Sean. This is Lisa. Jackie brings up a good point, and there are a lot of questions in the chat. So do you have a date that will have some answers in order to inform our own choices, our own decision-making about returning to in-person?
For teachers, the timeline for teachers, I don't have a firm date. Again, a lot of that is working conditions and subject to negotiation. So hopefully, I'm hoping maybe this week, not a deadline, but some information to have you be able to start thinking about that and putting in some request for what you would prefer to do. So I don't know how helpful that is. That's just the best answer I can think of at this point.
Sean, this is Donna Hirschfeld.
Yeah, hi, Donna.
Okay, well, so again, you have about 150 plus questions to answer from this. It's unknown what teachers are going to be going back health-wise or agree to do so, believing it's unsafe. That's an unknown. You can't assure that we're going to, or we don't currently have enough staff that is critical for cleaning and sanitation. We have subs, but how many subs are going to have to take jobs of teachers that may not be going back at all? What is your level of certainty that we can carry this off to any degree of success?
Yeah, I think
in 3 weeks. You've got 3 weeks.
Yeah, I think the first step is determining who's, going to, first of all, having employees request. But, we're kind of veering away here from the health and safety piece to this, I think. But
that's what all our questions are. We can't make any decisions about anything else because we have no specifics on health and safety.
Okay. Yeah. So, the first step is to have employees request what their preference is, and then having a process to determine all of that. And so that's obviously a key piece to the unknowns about, the staffing and what you mentioned. And as we said a little while ago, that is, working conditions and subject to negotiating. So we're working actively on that and hope to have an answer soon.
Hey, Sean, this is Kevin.
Yep.
Hi.
Hi, Kevin. Hi.
I just was kind of playing off of what Donna said as far as looking at all the chat talk. it sounds like, people want to go back, but we're not getting enough about the safety at school for us. Like, for instance, I went to school and saw that my desks, my tables had been arranged in my classroom. And so I noticed that, yes, all the children were 6 feet apart from each other, but there was no safe space in there for me, like at the board, at the document camera, by my computer. The places that were, laid out for the kids were less than 2 feet from any working spot that I would be in. So I think a lot of people are kind of like, it's hard to make a decision when these safety issues in the classroom, there's no like guarantee for us as faculty, so I see that as a big concern for us decision.
Yeah, that's helpful. Thank you, Kevin. So I think you're right. I've seen some people here say we have every question from the chat box, and we'll take a look at those. I was supposed to be in a 3:30 meeting, so I had hoped this would end at an hour. So I've seen several people who've copied and pasted all those from the chat box, and we will do what we can to get through the 200 plus questions that someone said was in there and give you what you need to be able to help, put in a request for what your preference would be. So I really appreciate everyone's participation today and joining in on this. I know it didn't provide all the answers you wanted, but hopefully it got you a little further along in understanding some of the protocols, some of the preventative measures that will be in place. What do we do if a student this or a student that? And, we hope to continue these conversations to help everyone feel confident and comfortable as we move toward November 16th. So thank you, everyone. And I hope you have a good rest of your afternoon.
Thank you. You too.
So what happened to November or October 19th?
Catherine, are you there still?
We can ask all kinds of questions. Nobody's going to answer them. I'm sorry.
So unfortunately, we are all called. We all have the same meeting that we need to attend. So if there are additional questions after Kirsten Higman said, thank you, Sean. If someone wants to copy the rest of those and send them to me, I'll add them to the list of questions that we have to get back to you.
Thank you.
Catherine, I just shared a Google Doc with you, and I did the questions the same as you, typed them as we went, and then copied the thing. So I just shared that with you.
Awesome. Thank you, Kelly.
Bye.
Thank you, everybody. We will be getting back to you.
Can I just ask a really quick, I haven't been getting any emails or updates about this, so I had to get this link from a coworker. How do I add myself so I'm getting emails?